Hello and welcome to Contagious Conversations. I'm your host, Claire Stinson. Every episode, we'll hear from inspiring leaders and innovators who make the world healthier and safer for us all. Contagious Conversations is brought to you by the CDC Foundation, an independent nonprofit that builds partnerships to help the Centers for Disease Control and Prevention save and improve more lives. Joining me today is Dr. Mona Hanna-Attisha, a pediatrician and a public health advocate who has worked on the Flint water crisis. Dr. Hanna-Attisha is founder and director of the Michigan State University and Hurley Children's Hospital Pediatric Public Health Initiative, an innovative program that provides the public health tools to advocate for Flint's children's healthy development. In this episode, Dr. Mona shares how she became a community advocate for the people of Flint, Michigan during the water crisis and her impact on the lives of the children in Flint. Welcome, Dr. Mona.
It's great to be with you, Claire.
So, Dr. Mona, you are a pediatrician, a professor, and a public health advocate, particularly related to the Flint water crisis. Can you tell us a little bit about your background?
Sure. So I started my career as an environmentalist, as a community organizer, really quite young. So in high school, got involved in environmental activism, worked to shut down an incinerator that was in a nearby neighborhood. That incinerator, then it was in the backyard really of an elementary school and a senior center. The kids in that neighborhood had higher rates of asthma. Adults had higher rates of breathing problems. So at a really young age, I was 14 years old, started door knocking and working with community organizations to shut down that incinerator, and worked to elect a state rep who the very first thing he did when he was in our legislature was close that incinerator. And it's been closed for about 20 years now. So at a very kind of young age, learned about the connection between environment and public health, its disproportionate impact on vulnerable communities and children, and really the power of policy and policymakers to make a difference in improving the lives of communities. So then I then pursued my undergraduate degree very much in kind of environmental science. I was at the University of Michigan in the School of Natural Resources and Environment. Then quickly found that connection into environmental health, kind of created my own major in environmental health. Then went to medical school. I realizing kind of the most intimate way for me to serve and to use these skills of science and math and advocacy was in medicine. And then naturally fit into the discipline of pediatrics, where I did my residency training in Detroit, Michigan. Pediatrics is of all specialties, I believe, just, in and of itself, public health and prevention. Everything we do for children is very much about, how they are today, but so much of what we do as pediatricians is about protecting the promise and the potential of our children. And very much as pediatricians, our job is also to be an advocate. I realized I also kind of needed the skill set and the tools to be able to make an impact at that population level. So I went back and got a master's in public health and health policy. And then that kind of brought me back to Flint, where I did my clinical training as a medical student in 2011 to lead the pediatric residency program. So really hoping as a medical educator to merge the disciplines of pediatrics and public health in the care of a population with a high percentage of significant disparities.
Wow, that's quite a background. What would you say you love the most about being a pediatrician?
I was in clinic yesterday, and hands down, what I love the most is our children. They give me energy. They inspire me. They wake me up every single day. Our kids, especially our kids in Flint, are bright and they are brave and they are resilient and they are strong. And they just instantly put a smile on my face. So that is absolutely what I love about being a pediatrician, is that one-on-one interaction with kids. However, as part of my job description as a physician, we have many hats. And one of those hats is, yes, as a clinician, but we're also researchers and we're also educators. And we're also advocates. And that advocacy work is one of the reasons I went into this discipline of pediatrics, and is really a reminder to so many physicians that we all have that opportunity to speak up for the children and the populations that we care for.
Amazing. Well, it sounds like you're a good pediatrician, so the perfect person to work with kids. Let's talk a little bit about the water crisis in Flint. Can you share how you became an advocate for people in Flint?
Yeah, so the Flint water crisis happened, it started really in 2014. Flint had lost democracy. We were under the control of the state. There was a financial emergency manager running the city. And that emergency manager's focus was austerity, it was to save money. And they decided that the water that we had been getting for half a century from Detroit, fresh Great Lakes water, was now too expensive for this poor, predominantly minority, near bankrupt city. So in April of 2014, Flint's water source was changed from the Great Lakes to the Flint River. And right away, there were concerns in terms of color and odor and taste and bacteria and boil advisories, and kind of the list goes on of lots of warning signs about this water. But throughout, everybody was reassuring Flint that everything was okay. And as a pediatrician for over a year and a half, I was also telling my patients that everything was okay. Families would come and they would ask, is it okay for me to bathe my baby in this water? Is it okay to mix my baby's formula in this water? Are you sure I should be drinking 8 glasses of water instead of pop or soda or juice? And throughout this time as a pediatrician, I was sharing that everything was okay because other scientists and public health officials and powerful people in government were saying that everything was okay. That all changed for me in the summer of 2015 when I heard about the possibility of lead being in the water. I'd heard about the color and the taste and the odor and bacteria and lots of chlorine and different disinfectant byproducts and all these different things. But when I heard about the possibility of lead being in the water, I no longer was reassuring my patients, because when a pediatrician with a public health background hears the word lead, it's a call to action. We know what lead does. It's probably the most well-studied neurotoxins. We know that there's now no safe level of lead. We also know that lead is a form of environmental injustice. So it was that pivotal point when I heard about lead that my role quickly shifted from a clinician to that of really a kind of a detective scientist researcher to see what was happening with our children if the lead was increasingly in their bodies. And then once again, my role quickly morphed into an advocate to really raise the red flag that this was ongoing.
Wow. So it sounds like you became a disease detective.
Absolutely. And I think that's what I love about public health. And I think that's why so many folks go into public health, because of the sleuths that so many public health folks, hope to be. If we go back to the stories of Jon Snow, who found out that, hey, it was cholera that was, it was drinking water, contaminated drinking water that was causing these cholera epidemics. It wasn't stinky air that was commonly believed. So it was kind of shoe on the ground, boot leather, epidemiology, detective work that attracts me to public health, but also was critically important in the discovery of what was happening in Flint.
So, Dr. Mona, why is lead so dangerous for children?
Yeah, so like I said earlier, we know so much about lead. Really, for centuries, we've known that lead is a poison. There's even strong theories that hypothesize the demise of the Romans is because they use so much lead in their plumbing, but also in their food. So lead is a potent, irreversible neurotoxin. It impacts the development of children. It impacts their cognition. So at a population level, lead exposure shifts that IQ curve to the left. You have more children who need, for example, special education services, less children who are gifted. It leads to things like developmental delays, attention deficit disorder. It's even been linked to things like criminality. We also know that it impacts older folks, not just kids, but can impact, for example, things like early dementia and hypertension, a whole slew of bad things that lead causes. And because of this incredible science, especially so much of the science that has come to light over the last few decades, we now know that there is no safe level of lead, and that as a population, we should be practicing something called primary prevention, which in the world of public health means that children are never supposed to be exposed to lead. And when we find it in the environment, that should be enough. That should be when we start taking action because of what lead does to children and how it can really alter that entire life course trajectory of that child.
So that's really interesting and terrifying. It sounds like there's a lot of risk there.
Yeah, there's a lot of risk. And, it's also a public health success story, sort of. I use caution there because, so many people have touted that we've done such a good job reducing lead exposure that because of that, we forgot to pay attention to lead, and we've lost a lot of the funding and resources to take care of the ongoing lead problem. But, back in the day, we had more lead exposure because of industry's use, really forced use of lead in gasoline and paint and plumbing. And finally, because of great policies, we restricted those uses, and the exposure of lead has gone down significantly. It's still not where it was, for example, pre-industrial time, where we really didn't have any lead in our bodies. It peaked with the use of obviously lead in gasoline, and it's come down quite a bit. So children are not exposed to as much lead as they used to be. Kids in the 60s and 70s had a lot more lead exposure. But at the same time, we have to respect the science that has gotten us to the point of recognizing that there is no safe level of lead. And we also have to take note of its disparities of exposure. The burden of lead, just like so many of our environmental contaminants, does not fall equally on our nation's children. Kids in Flint already had higher lead levels than other kids, for example, in the suburbs, just like kids in, for example, Detroit and Chicago and Baltimore and Philadelphia. So there is a disparate burden of exposure, which is why lead is very well known as a form of environmental injustice or a form of environmental racism.
Well, you sound like a good spokesperson for this issue, I have to say.
Yeah. And I mean, there's been so many great spokespeople. In my book, I talk a lot about the history of lead. And it's so important because we have to understand that, we're hearing a lot about lead right now, especially after Flint. But this is something that the activists and doctors and public health scientists and moms and so many folks have been fighting against really for decades, if not centuries. And if I can quickly share, my favorite hero in this story is a woman named Alice Hamilton. She was the nation's lead expert a century ago in the 1900s. And she, with all her might, went after General Motors, who was putting lead in gasoline. At that time, General Motors called lead a gift from God. And she knew it was toxic and she warned folks, but industry prevailed. And what set forth because of those discussions was something called the keyhole paradigm, where industry kind of made a deal, General Motors made a deal saying, if you can prove that lead is dangerous, we'll take it out. And that's what this keyhole paradigm is all about. It's like it's safe until proven dangerous, which is completely the opposite of common sense, opposite of the precautionary principle, where really we should be governed by dangerous until proven safe. However, that paradigm that was set a century ago has persisted and has allowed for the unchecked use of thousands of chemicals. And when it comes to lead, really has silently poisoned the generations of children. I stand on the shoulders of giants. I know a lot about lead because so many folks have done this work for so long, yet the legacy of lead persists.
So it sounds like maybe you're a modern day Alice Hamilton. Would you say that's maybe true?
No, that would be too much. She's amazing. She's a hero, and I absolutely adore her.
That's a powerful story. So speaking of stories, is there one story from Flint that resonated with you the most?
There's so many stories and there's so many patients that have stuck with me throughout this crisis. And I'll share a quick story about a little girl, two little girls, their siblings, who came to clinic in the summer of 2015. And the little girl was there for her 4-month checkup. And her mom had come and was sharing that she was going to stop breastfeeding and that she was going to transition to formula. And she asked me, "Are you sure I can mix my baby's formula with the water?" And of course, I tried to encourage her to continue breastfeeding, but she had made up her mind. She had to go back to work. The family was dependent on her income. She couldn't risk losing her job. She worked at a restaurant. There was no place to pump. It was just impossible for her to continue breastfeeding, which is another story that we need to address. And she asked me, point blank, is the water safe? And this was before I'd known about lead, and I had the older daughter in my lap, a 2-year-old daughter, and she was inches away from me. And the older daughter was also kind of staring at me. And the mom asked, "Is the water safe? Can I mix my baby's formula with this water?" And in my kind of white coat on doctor confidence, I reassured her. I said, yeah, the water's safe. I mean, like, how can the water not be safe? This is America, the 21st century. We're the richest country in the history of the world. There's rules and there's regulations and there's people that our tax dollars fund to make sure that when we turn on our tap, our water is okay. And in my head, I was also thinking, like, how could the water not be safe? Because this is Michigan, and we are literally in the middle of the Great Lakes, which are the largest source of fresh water in the entire world. Like, how can our water not be safe? So, as you know, and it's hard for me to admit that this conversation happened. Our water wasn't safe, and that story has stuck with me. That family has stuck with me. Obviously, there was significant follow up that happened afterwards. When I became a pediatrician, I took an oath to protect children. I literally stood up and said that I was, going to do whatever I needed to do to make sure that our kids were healthy and safe. Yet here was, a year and a half of this ongoing crisis when I didn't know what was going on, that I was reassuring families and fundamentally had been letting them down.
Wow, that's really powerful. And I'm sure that really did stick with you throughout your whole experience becoming a public health advocate for those children and those families.
Yeah, absolutely. And, even in the lowest moments of this crisis, for example, after I shared my research and the state was saying I was wrong, and a part of me wanted to hide and give up, what really kind of lifted me up and got me back to fighting for children's were those stories and were those individual children. Because my research, it was a bunch of spreadsheets and it was a bunch of data and a bunch of statistics. Every single one of those numbers was a kid. A kid I'd probably even seen with the last year, kids that I had known, that I'd examined, that I had played with, that I'd, given fist bumps to. So it was those kids that literally jumped out of my spreadsheets and got me up and gave me the courage to keep fighting on their behalf.
Well, you're very passionate and it certainly comes across. So it sounds like you're a great advocate for these families.
I hope so. I'm privileged. I mean, I wake up every day privileged to be able to serve my children in Flint.
We'll be right back with Dr. Mona. Since this is a show about contagious conversations, we want to hear from you. Each episode, we ask you a question, and this episode's question is inspired by the community advocacy work of Dr. Mona. How have you made an impact in your community? Just email info@cdcfoundation.org to answer. That's info@cdcfoundation.org. And if you share your thoughts with us, you'll have the chance to win some CDC Foundation merchandise. And now, back to our conversation with Dr. Mona. So let's talk a little bit about your book. What the Eyes Don't See is a firsthand account of the Flint water crisis. Congratulations, by the way, on the book being named a New York Times Notable Book of 2018.
Thank you.
What are you most proud of related to this book?
It was a tremendous feat writing a book. I have a whole new respect for authors. It is a lot of work to write a book, and I don't think I ever could have anticipated that. So just to be able to finish this task was huge for me, because this was on top of everything else that I was doing. This was not during work time. This was on top of kind of family time and nights and weekends of doing this work. And as a physician, I think like most folks out there, I'm very type A and OCD. So the hardest part about doing this book was turning it in. I could have kept going on and on and on and on in terms of side research and digressions and editing. So I think the biggest feat was really just accomplishing it to begin with. And the story is very much kind of this firsthand account of what happened in Flint and my role. But the story is also very much a memoir, which is unexpected for a lot of people who pick it up, who think that they're just going to get a Flint story. So in that respect, it's an immigrant story. I'm a first generation immigrant. So it really weaves a lot of kind of family history and an immigrant perspective and an immigrant lens to this work. And I felt that was critically important to weave into the story, because to know kind of what I do and why I do what I do, you have to know who I am and where I came from. And especially in this current climate that we're in right now as a nation, I felt it was critically important to share that perspective of, here I am. as someone who wasn't born in this country, who came to this country very much for what all immigrants come to this country for: freedom, opportunity, democracy, somebody who came to this country who that American dream was absolutely realized for. Yet here we are with the climate of Lady Liberty's arms not being as open wide as it was when I came to this country. So that was kind of a more complicated weave of this book, but I felt it was almost an as powerful story that needed to be shared.
Well, it sounds like you really made it resonate with people. Stories resonate with people. And so you made it relatable, which I think is a really important part of storytelling. You are the founder and director of the Michigan State University and Hurley Children's Hospital Pediatric Public Health Initiative, a program to help mitigate the impact of the Flint water crisis. Can you tell us more about this program?
Absolutely. So this is the awesome work that I get to do every day. And, from the moment that we recognized that we had this population-wide exposure, our focus became, what are we going to do next? How can we best mitigate the impact of this crisis? The crisis was more than just about lead. We had an outbreak, for example, of Legionnaire's disease, where people died from pneumonia. We had massive skin issues. But by and large, it was a crisis of trust. People felt betrayed by those who were supposed to protect them. There's raw emotions of anger and fear and guilt and anxiety and stress. And all of these things in and of themselves can lead to poor outcomes. So we kind of put this whole crisis, we contextually framed this crisis as a trauma, and really leaning on the incredible science now that we know of early adversity and toxic stress and resilience and child development, put into place a system of interventions to mitigate this trauma. And this is all happening on top of a community that was already rattled with so many toxicities. For example, in Flint, we have almost 70% child poverty rate. We have no full service grocery stores, high unemployment, and decades of disinvestment and racism and other kind of structural issues that have created so many disparities in the community. And then the water crisis was on top of that. So the public health initiative really has this broad mission of improving overall outcomes for Flint children, really serving as a model for the nation in terms of recovery and hope and healing, and really being able to share those best practices that we are doing in Flint to other communities, because the story of Flint, and this is what I hope to share, the story of Flint is not an isolated story. It's really a story of kind of what's happening to so many of our communities and so many of our nation's children, be it a story of poverty, a story of lost democracy, a story of stolen opportunity, but another story of a place where your zip code is your greatest predictor of your life outcomes. And that's not right, and that's not how it should be. And what we've done in Flint is, as a community, really hand in hand with so many of our community organizations, but also hand in hand with our parents and our children as partners, put into place this model initiative to mitigate the impact of this crisis in a very trauma-informed way. So as a community, what we've done is leaned on the science of child development and expanded things like home visiting programs and early literacy promotion and breastfeeding services, childcare opportunities, and school health services, Medicaid expansion. The list goes on of what we've been able to put in place to promote the development of children and to not see the consequences of this crisis. Professionally, morally, ethically, we couldn't just sit back and just see what would have been, the consequences of this crisis. We knew what would have happened. So as a community, and this is what I love about Flint, it's kind of really resilient and proud and loyal philosophy. As a community, folks came together, rolled up their sleeves, and built all of these interventions that we now have in the city to mitigate the impact of this crisis. And what we're hoping to show is that, what we're doing in Flint can be replicated in other communities. And I'll just share a quick example of how that's already happened. My clinic, which sees the most Flint kids, is located on the second floor of a farmer's market, which was a very purposeful move by us to address nutrition security issues. Every kid that comes to my clinic, no matter if they're there for an ear infection or a well baby visit, gets a prescription for fruits and vegetables. It's written just like a prescription for antibiotics or anything else. Families fill it in the farmer's market, and it's worth $15. We robustly evaluate that with our public health nutrition colleagues. And because of the success of that nutrition prescription program, our U.S. Senator Debbie Stabenow put a nutrition prescription program in the U.S. Farm Bill. It passed Congress and it was signed by the president. So this is just kind of one example of how one little thing that we are doing in Flint is really inspiring national policy and hoping to impact children all over this country.
Wow. That's a lot of amazing programs under one initiative. Are you really proud of the impact so far?
Absolutely. And we are just beginning, though. So our work really is just beginning. This is long-term work. To date, we don't really have the capacity and the resources. A lot of these efforts are state, federal, philanthropic funded, but they're not funded for the long term. And that's actually another reason that I wrote my book, because part of the proceeds go to our Flint Kids Fund, which enables us to continue supporting, for example, the home visitors and the literacy support programs and the breastfeeding capacity building. So this is work that we need to be doing long term. So I'm proud of what we've been able to do as a community, but I'm cautious and worried about its sustainability.
Well, best of luck with sustaining that, because it sounds like really important work.
It's important work for Flint kids, but it's really important work for all kids. So what we are doing in Flint really these are things that should have been in Flint decades ago, but these are things that science tells us that all kids need. All kids need great nutrition and early education resources and access to healthcare. So it's really common sense, science-based work that we're putting into place, but really that I'm hoping will kind of resonate nationally and be adopted elsewhere.
Right. Absolutely. No, important points. So speaking of communities, in your view, how can we empower people to play a larger role in improving the health of their city or community?
That's a great question. And that's so important for Flint. The story of what happened in Flint is such a story of an environmental injustice, specifically because the voices of communities were dismissed. The people of Flint were loud and they were brave and they were heroic and they were organized. Yet throughout this crisis, they were being dismissed and denied and literally told to relax. So I think the biggest lesson that we have learned is the importance of participatory democracy and the importance of self-determination. And that is why all of our work in Flint is in partnership with community. And that's very much the philosophy of Michigan State University's public health program in Flint. It is all based on being community-driven, community-informed, and community participatory. And in my little initiative, we've formalized that in a couple ways. We have a parent partner group. So we have a group of parents, moms, dads, and grandparents and foster parents from every part of the city who advise us and of all of our work, who tell us kind of what we should be doing and how we should be doing it. And we've taken it a step further. We actually have a group of kids who named themselves the Flint Youth Justice League. So an amazing group of kids aged like 8 to 18 who are leading so much of our work, who are telling us what we should be doing. And that is such an important kind of lesson right now. Our youth are brilliant and they are powerful. And if you look at examples from Parkland to the climate change activists, they are literally changing policy and the trajectory of the world. So we need to do a better job closing our mouths and listening to our kids. And that's a big part of what we're doing in our Pediatric Public Health Initiative, is actively including the voices of children and community in everything that we are doing. Another incredible part of, or important part of recovery, I talk about all the great things we've been putting in place, like, home visiting programs and healthcare access, and nutrition support, and all these things that promote the development of children. But I'm not naive to think that is enough. I often say that the strongest kind of medication that I can prescribe to families is living wage jobs for their parents to really lift them out of poverty. So all of our work deliberately is also bringing in jobs to Flint. And our Pediatric Public Health Initiative, including our Flint registry, has brought in probably 40 plus jobs And a lot of those are for Flint residents. And that's another critical part of being community engaged and community driven, is making sure that the work is done by the community, for the community, with the community.
Well, you're certainly a leader in Flint. And I love the idea of a Flint Youth Justice League. I love that name too.
They're awesome. They just came up with their logo, which is like, they're all superheroes. It's fantastic.
Oh, I love it. I love it. Tell us about the progress in Flint. How are things in Flint today?
We are still on filtered water and bottled water in Flint, but that's for a good reason. That's because our pipes are being replaced, which is fantastic. And that will be done within a few months. And we will only be the third city in the country that has replaced their lead pipes. That's awesome. We never should have been using a neurotoxin to deliver our drinking water. It's mind-boggling. So I'm hoping that after Flint, and it's already happening, many more cities will decide to invest, and states, in getting rid of the lead from our drinking water infrastructure. So that's good news. But until then, precautions are still in place regarding bottled water and filtered water, because whenever you do infrastructure work or any kind of earth moving work, it has the potential to disrupt lead scale and increase lead release. That should be completed within the next few months. So that's kind of where we are in regards to the water. But in my world, which is where we are in regards to the children, like I said, we've been able to put in so many incredible interventions to mitigate the impact of the crisis. We've also recently launched something called the Flint Registry, which is a CDC-supported, massive, population-wide registry to see how Flint is doing. But more importantly, to see how Flint is doing, this registry is all about improving public health. So once people sign up for the registry, they then get connected to a lot of the awesome that we've been able to bring in, from expanded Medicaid to early childcare to literacy support to mental health services. And then we'll be following folks over time with this registry. So lots of great things happening in Flint, and also very much building kind of the data-driven tools to be able to share how the city is doing.
So lots of progress. And it sounds like a little bit of cautious optimism around where you are with the water.
Absolutely.
So Dr. Mona, are there other public health challenges that you are hoping to tackle in the future?
One of the great things about Flint is the ripple effects that it has had really throughout our nation. It's really opened people's eyes to issues that might be happening in their own backyard. Drinking water issues, because of Flint, have been elevated. I think I probably spend half my time now working with other communities that have concerns. For example, I was just in Newark, New Jersey, which is also in the midst of very similar lead and water issues, and helping that community and their residents educate on how best to protect, especially the children. So, schools are finding lead in water. There's a need to strengthen regulations. There's now an increased discovery of other contaminants in water, like the PFAS, PFOA issues, the flame retardants, which have contaminated a lot of drinking water supplies throughout our nation. So there have been so many incredible ripple effects where people are now paying attention to our drinking water, recognizing that we need to do a lot more to protect public health and children's health in terms of the safety of our drinking water. We're also seeing an increased attention paid to lead. Many people thought lead was a problem of yesterday, and it's not. It's a problem of yesterday, yes, but it's a problem of today, and it's a problem of tomorrow. And we've made great strides, but there's a lot more that we need to do to finally eliminate the lingering legacy of lead. So lots of great things have happened since Flint that have really been outside of the city.
So you're not slowing down. You have lots more to tackle in the coming years.
We have a lot of work to do all over this nation.
Well, Dr. Mona, it's been such a pleasure talking to you today. We really appreciate you sharing the story of Flint and your involvement. It's really powerful, and we hope to talk to you again soon.
Claire, thank you so much for having me.
Thanks for listening to Contagious Conversations, produced by the CDC Foundation and available wherever you get your podcasts. Be sure to visit cdcfoundation.org/conversations for show notes and bonus content. And if you like what you just heard, please pass it along to your colleagues and friends, rate the show, leave a review, and tell others. It helps us get the word out. Thanks again for tuning in, and join us next time for another episode of Contagious Conversations.